is leading NHA Services, which is our preferred business partnership program, which so many of you know. Today, we're going to talk about the NHA Connectivity Consortium, and did want to provide a little bit of context and history here. So I have been with the NHA this is year 3 for me. And what I'm really proud of is I have seen our connectivity consortium continue to grow, which means there's more revenue, or more dollars streamlining to Nebraska hospitals. We've seen when I first started, we were applying for roughly about $500,000 in subsidies. And what you'll learn today is that in the year ahead, we're looking at applying for over $5 million on behalf of Nebraska hospitals. So the reality is here at the NHA, we know that our hospitals are hurting, and we want to make sure that we can provide resources and solutions that help with that financial burden. And the NHA Connectivity Consortium does just that. So with that, I want to introduce our consultant and personal friend of mine, Randy Resnick. He's with Federal Funding Group. Randy is one of the consultants of the team with FFG that supports the NHA Connectivity Consortium. So, Randy, with that, I will go ahead and turn it over to you.
Thanks, Mike, and appreciate being able to be with everyone today. Thanks for joining us and taking your lunch hour to learn about the consortium. Many of you already know about the consortium, and thanks for being with us today. We'll learn about some of the program updates and the schedule for the next funding year. So whether you're with the consortium or new to the new and learning about the consortium, there will be something for everybody today. We always start with a level set. So people that may be unfamiliar about the program and what exactly that it is we're talking about today, we just start off with this little thing. And this is something that you all contribute to. And you look at the bottom of your telephone bills, and there will be a section in the tax section called the Universal Services Fund. And it goes to a big pile of money in DC, and it's called the Universal Services Fund. And it gets doled back out to schools, libraries, and healthcare providers. And we participate in the healthcare provider part of that, which is called the Healthcare Connect Fund. Currently for 2025, it's slated for about $708 million, but it seems like they always find a little bit more money if we go over a little bit from unused funds in the previous years. But right now, $708 million slated for 2025. It subsidizes broadband connectivity, infrastructure, maintenance, and management. Important word, subsidizes versus grant. It's a subsidy, not a grant. You're not competing on the basis of merit for these funds. If you're eligible and you have eligible products and you make a proper application on time, then you're eligible for the funding. Provides a 65% discount, or the discount's probably the wrong word, subsidy on the eligible applications. And it does encourage the use of consortiums, and we'll get into that in a bit, just to maximize the funding available under the program. Who's eligible? Probably if you're a nonprofit healthcare provider, then you're eligible. In Nebraska, we have large urban hospitals, small critical access rural hospitals, community health centers, mental health providers. There's also skilled nursing facilities, secondary education facilities, teaching healthcare. All of those are eligible facilities. So if you're on this call and you're nonprofit, you're eligible. just wanted to just briefly mention our team. We were hired by the association, and that's why we have a different email address in the association, and you hear from us. But we were hired to administer the program for the hospital association. We work in more than just Nebraska. We have several other contracts. We have a deep expertise in consortiums. And in 2024, we were involved in roughly $15 million in funding requests. These are some of the people you're likely to hear from throughout the year. So just wanted to point out that we've got a full team behind our efforts in Nebraska. All right, Mike mentioned some of the numbers. We like to point out some of the stats here. About 20 participating consortium members, and the number grows. Many of those folks started off in the consortium, and we started the consortium in 2021, and with two members. I think it was Grand Island and Lexington. And by the way, we throw names around quite a bit because it's a public program. And if you're participating in the program, you're part of a public data set that anybody can pull down from USAC. And so your projects are public data. Your name is public that you participate in the program. Your vendors are public. Your awards are public. So we tend to throw the names out there because of that. And number two, that we know that you share notes a lot within the state at meetings and collaborations, and if you know that somebody's having best practices within a funding effort, that somebody else might be able to take advantage of that knowledge at some point in the future. So we're going to throw some names out as we go forward today. So we started out with Lexington and Grand Island, so we tend to think those are pretty smart hospitals back in 2021. And with those, and then we're now up to 20 participating entities, and those consist now of over 100 locations, and we'll talk about why that's important in a little bit. And you can see that as we've grown, the number of applications have grown. Mike said we started off with 500,000, actually started off with just a couple 100,000 in applications, and now we're up to over 5 million in applications. The majority the vast majority of this was funds that were not being brought into the state, and new money being brought into the state, whether the folks were participating in the program before or not. All right, so this might be review for some, but it's always good to review. It's also might be new information for some, but these are all the eligible services in the program, and these were the main eligibility buckets, if you will. There's a full spreadsheet of detailed eligibility, but these are the main category. You see two of them that I have highlighted in red here. These are your data circuits in the broadband category that we speak to quite a bit. And these are anything from internet circuits to wide area network circuits. If you can think of something that would connect buildings or yourselves to the outside world, monthly recurring cost scenario to a telecom provider that's going to qualify in one of these two buckets. And I highlight them in red because what we have seen over and over again, not only in Nebraska, but in many other places around the country, is that people that have been participating in the program and they really put their participation in the concentrating in the circuits, and they leave out many of the other areas of eligibility. And there's a few reasons for that, but we highlight those in red. because when we started with the association, we said, we told them that. When we looked at some data and said there's a lot of area that's being left out and people aren't taking full advantage of the program, and there's more dollars available for Nebraska if people would just take more advantage of the program that they're already participating in, or maybe not participating in. But we'll help them get more dollars out of the program. So I just highlighted those in red because that's really where we saw most of the participation taking place. ISDN PRIs still eligible. I know people are migrating to SIP, but if you still have PRIs, they're still available in the program. Switches, routers, and firewalls. Those are the main pieces of equipment that are eligible in the program. We know everybody purchases them. Not everybody files for subsidy on those large purchases. Along with switches, routers, and firewalls, the equipment, maintenance, warranties, and some of the expensive stuff that goes along with it, also eligible under the program. Network management, operations costs to operate and manage your network. All those costs also eligible under the program. Fiber, if you build, operate, own your own fiber, those costs can be eligible under the program. Off-site data centers or admin sites, also eligible under the program. Now you see I've got 3 boxes highlighted in green. We talked about some advantages being as a consortium member. If you're not a consortium member, you can't apply for the subsidies in the 3 boxes that are highlighted in green. So things like network management, which you're going to see there's some big awards being out there in Nebraska for network management. Firewalls, everyone buys firewalls, and they're expensive and getting more expensive, and especially with some of the cybersecurity events going on out there in today's world. Offsite data centers, not everybody employs those, but if you do, some of your biggest telecom costs exist at these sites. And if you're not a member of a consortium, you can't apply for subsidies in these categories. So being a member of the consortium allows you to, again, maximize your funding under the program by applying for subsidies in all the categories available. So I wanted to go back and show some more statistics here to show that what we told the association when we were hired early on, that we're actually delivering on, and that we have some statistics to prove. What this is showing is, I know this is small, hopefully you can see it. The applications split out by the eligibility buckets. And you can see right out of the gate in 2021 with Grand Island and Lexington, we had applications, and you can see the top 2 bands represent the data, the 2 boxes that I said everybody concentrates their applications in. The next one is network management, and the next one's equipment. And you can see a very good distribution. As we went on in the years, you can see that network management is becoming a very big part of what we're getting awards in, and equipment is still a big part of what we're doing. So we're getting we're actually skewing more towards the additional services, and partly because some of the folks that are coming into the consortium are using the consortium for things other than those circuits. They're keeping their existing consultants in place for their circuits, which is totally great with us. And they're using us for the consortium only items, which is fine. So we're skewing a little bit towards these, but we wanted to make sure everybody know, and even the hospital association, that we're delivering, and we're making sure that people are maximizing their use and getting all the dollars out of the program, and not just the circuits like so many others are doing. 2024, you're seeing that small sliver because we're still waiting on commitments for 2024. This is what's been committed so far, and these are graphs that we pulled from numbers right out of USAC's system. So that's why you're seeing them the way they are. So this is what's committed so far for the 2024 applications. All right, so we'd like to show this this slide. If you're out there working in the program, you may be working with another in another consortium. You may be working as an individual with another consultant. There's nothing that says that you have to change anything that you're doing today to work with the consortium. You can keep doing everything and let the consortium take a look and see what you're doing. We will come in and take a look, do a quick custom analysis and let you know if we think there's any gaps in your funding, and we'll help you fill those gaps. And we won't try to hard sell you on moving everything to the consortium. We'll just help you fill those gaps. Again, if you're filing as an individual, there's some additional eligibility. There might be some additional sites that become available to you. So we would help you look at those and see if there's any additional funding available to you. And you know, I didn't mention this earlier, but if you're an individual filing, there's some caps on your projects, and that's another advantage to being a member of the consortium. And the consortium size is another consideration. If you're an individual filing and you file for a infrastructure project, you're going to be capped at $50,000 for the infrastructure project. It's a member of a consortium. That formula changes to $50,000 times the number of sites in the consortium. And that first slide, I think I showed, or the statistics showed you a little over 100 sites. So now we're over $5 million in terms of infrastructure projects that can be, and it's not $500 cumulatively, it's $500 for each project that can be applied for. And we had a large urban member have a multi-million-dollar hardware application this year as part of the application stack that we delivered this year. So that really played well for that particular hospital this year. And you know, I know that doesn't apply for everybody, but it really is going to be helpful for some of the larger folks to be part of those larger the larger consortium. Last thing I'll bring up is audits and record keeping. Is, you know, this is a government program, and audits occur. We have had audits in other states, and they're not for the faint of heart. They will do things like come on site, take pictures of DMARCs, have you take pictures of DMARCs, validate serial numbers and addresses of equipment. They, if things don't look kosher, they could demand subsidies get sent back. And so, and there are some obligations that people that are participating in the program have regarding record keeping and how they comply with audits. So the consortium will lead your, hold your hand, lead the effort, and take care of the audit, the audit effort, and work it to completion. So I just wanted to point that out, that is something that sometimes gets overlooked, about people thinking that maybe we should just start. We have three sites. Maybe we'll just start our own consortium. There's some things that go along with consortiums that sometimes some obligations that the hospital association has already taken on for you, and just encourage you to take advantage of that. This next one is not necessarily about transitioning the consortium, but I just wanted to mention NUSF 57. The consortium also files NUSF 57 applications for all members, and this is in addition to and at no extra cost to consortium members, because it's the same paperwork. And so each year, as we get the approvals from the national program, we turn around and if you didn't know, NUSF 57 is the Nebraska Universal Services Fund, and it's meant to address what the 65% doesn't address out of the national program, and to augment the additional dollars that the hospital spends within the telecom spend. So it's meant to add additional dollars to what you're getting out of the national program. And so the consortium is filing those automatically for you when we get the national approvals. We can say that the first year we did that was for our 2023 approvals. The NUSF 57 funds were exceeded that year, I think for the first time ever. We haven't seen any disbursements yet on the 2023. I think as a result of us the exceeded, and we're now entering the 2024 NUSF 57. So we're waiting for news on the disbursements, but we're going to continue to make those applications on behalf of the members, and we'll keep everybody appraised when we hear more news about how those disbursements are going. But that will continue to be a part of our program. Continue to file for not only the national program but the state program at no additional charge. All right, so I wanted to. We talked about some of the hospitals. There was 20 hospitals participating currently. A number of them came into the consortium as new members, right? So they came in, they've never participated in the program before. We look at that as no-brainer. Take advantage of the funding you're eligible for. We mentioned Grand Island and Lexington. They came in when the consortium opened. We think they're smart. People that came along the way, some of the urban hospitals like Madonna, Bryan, held some of the larger folks. We had folks from the community health, the HCAN organization in Nebraska, Blue Stem, Good Neighbor, One World, all organizations that joined. Number of sites, again, that helps the consortium. They're grabbing funding now that they really didn't even know that they were eligible. But then we had a number of hospitals then that also were participating in the program before, and and many of you might be out there going, well, we're participating already. Is it really going to make a difference if we go over to the consortium and have them take a look at us and see what we're doing? So we have a few examples of some hospitals where they've been participating all along and then came over to the consortium and give an example of what occurred. So this is Johnson County. Not sure if they're on, but again, we name names because it's public data, and you might know some people and you can share notes. Joined the consortium in 2023. You can see we were able to identify some additional funding in the first year. And you go, well, that's pretty good. Extra $35,000. Not sure exactly where all that comes from. It's sometimes additional sites, just additional eyes, maybe the equipment, some of the extra areas of categories of spend. And then if you look at the next slide, and you look at what happened in 2024 with Johnson County. So this particular line here is this line here. And granted, some of this is going to be multi-year in a network management scenario. So you're going to see it come back down probably 2025, but you'll see multiple hundreds of thousands of years of funding. So Johnson County participating in the program, over a number of years, joins the consortium in 2023, and you can see they really bumped up their funding by their participation. Callaway District Hospital on the western end. Kind of the same scenario. I was able to go out and meet their this particular scenario was a network management. This was a third-party IT company that they had been using, a sole proprietor. I mentioned I was able to go out and meet those guys, had lunch with them. We spent a fair amount of time coordinating with the vendor to get them signed up in the program. Was able to get them signed up and have been getting nice awards in that space ever since. So again, somebody participating in the program all along. And by the way, these guys are still filing their circuits through their same provider that they had been. We've just picked up the network management piece with the consortium. And again, that's great. That's great for us. Providence. Network management and equipment. Kind of the same thing. Participating all along through education, planning, vendor coordination, and our high-tech approach. We're able to immediately jump up their funding participation in the program. So if you're out there thinking maybe that we've been having pretty steady participation, and our participation in the program all along, we're happy to give you a no-cost, quick analysis and help you determine if there's that extra funding available for you, and help take advantage of it if there is. All right, so I'm going to turn this over to Tracy Hines. If you have not met or talked to Tracy, we're really lucky to have her on our team. She's one of the foremost experts in the country on the Universal Services Fund and the Healthcare Connect Fund. And I see her shaking her head, but it's true. And we're all lucky to have her working for us. And she's going to go through some program updates and talk about the schedule for the upcoming application year.
Thank you, Randy. Hello, everybody. The Healthcare Connect Fund, if you haven't already heard, is for the nonprofit healthcare providers. And we have been doing the funding commitments for Nebraska for a couple of years. The 2024 application window closed, and we've already started to receive funding commitment letters, which is great. That means USAC, the administrator of the program, is working and getting things done. The demand for 2024 was $788 million. The program itself started with $400 million as the bucket, and then over the years with unused funds, as well as adjusted for inflation, they're able to put all of that extra money to fully fund the $788 million. Of course, things may change and it may not settle out to be 788. Some people don't move forward with projects and such, but that's very encouraging that the money is there. The program is very strong and everyone's doing really well participating. One of the new rules that was implemented this year for Fund Year 25 is conditional approval for locations. And what that means is if your site is not open, it can still go through the funding request process as long as it will be open during the Fund Year 25. So we can But before, if your site was not open and operational, we could not request funding for it, which was a deterrent and against the spirit of the program that also offers construction, installation, and equipment purchases. So if your site was not open, you couldn't take advantage of those eligible services. So now, after some pushback to USAC and the FCC, they've granted this conditional approval. So if you've got a site that's going to come online in January of 26, you've got that on your project timeline, we can apply for conditional approval of that location now, get it eligible, say this is going to be a rural clinic and it's going to provide XYZ services January of 26. But we can put it in the application window now to make sure we can take advantage of it later. So that was very encouraging that they finally got that going. And then the cybersecurity pilot. Cybersecurity is the big buzzword and so needed. And the support is needed. Right now, they are doing a pilot with the E-rate program, which is the schools and library program. It's rolling out for fund year 25. And as history has shown, things that go through the E-rate program, tried and tested, will roll down into the rural healthcare program. So I'm encouraged that they're doing the pilot, encouraged that we'll probably see some relief in that domain within a year or two. Fingers crossed always. All right, the next slide. All right, this is our timeline. This is USAC's fund year. So July 1 to June 30th is the USAC fund year. Right now, we are doing our outreach and preparing for fund year 25. So everything that we're doing today, the outreach that we're doing with you, going through your inventories and such, is for next year. So July 1 of 25 is what we are preparing now for. So we will walk through the USAC process. Fair and open bidding has to be done for it. If you receive federal funding, that had to have gone through an RFP process. So we'll be starting that, posting the RFPs within the next month or so. And we like to do it as a consortia level to encourage service providers to offer better pricing. So instead of reaching one or two members, they can reach everybody and then possibly bring down some pricing. So it provides an opportunity for them and an opportunity for the members to see what else is out there. So we'll be posting that RFP probably in September. It posts for 28 days. And then on that 29th day, we'll connect with you to see if there were any bids received. If so, what does that mean? What does it look like with your existing services? And then our deadline to submit that funding application to actually ask for the money is April 1st. So we can start applying for that funding April or December 1st, as long as it's done by April 1st. That's a hard deadline. And then the funding would be available July 1st. That would be the earliest you'd be able to take advantage of that funding. And then we have a little mention in there about equipment. So if you're purchasing equipment, it's very important that you not take delivery, purchase it, and get it installed before July 1. Excuse me. You have to install your equipment during the fund year. So July 1 of 25 through January or June of 26, excuse me. So that's our timeline. That's why we're reaching out and bothering everybody. We're getting together, seeing what you need, what's out there, and walk through the process with you. And so the next slide, this is something that we've put together to help plan, to do project planning. So if you needed a new firewall in January of 26 due to budget issues and such, we need to apply for it now. So it's hard to do with equipment. Sometimes you have to break it and fix it and do it when it happens, and that's fine. You got to do that. But if there's a project plan, this is where you're going to see the most savings. We put it up on raining out, put it up on a whiteboard and mark the milestones of your project. Back it up to find out which fund year application we need to apply for it. So right now it's, let's see, July, almost August of 24. We are doing the applications for July 25 and to be installed and operational before June 26. So it's that whole 12-month fund year. So that's where we're at right now. And then just, it's when I have the conversations with our members, we just talk about, well, we don't have a magic crystal ball, but if this is something that you think that you need in the spring of 26, let's apply for it now. Let's get it in place. And then if you don't need it, that's okay. But at least we've asked for it, planned for it, and you've budgeted for it. So yeah, my slide. That's the last one. There you
Thanks,
go.
Tracy. So I'd like to then conclude by talking to our existing folks and some of the people that might think, and that's member optimization. If the people that get the most funding out of the program also have a champion within their staff, if we are calling up to set up meetings or calling to get information and we don't get a hold of anyone, or and can't set up meetings, or we're not getting any engagement, those hospitals will not get the funding that other hospitals will get. So the folks that have a program champion, especially if their performance is evaluated on program performance, we see those hospitals get the most funding. Second, one of the ongoing issues with the program is we need invoices. We'll need invoices of your service providers, not only to apply for funds, but we're going to need invoices to apply for the dollars once the funds are committed. And we'll need like a full year of invoices from providers. So providing portal access and allowing us to get those invoices without having to bother you, we think is the best practice. Now, we know some security policies prevent that, but to the extent that we can automate that together, we think is going to help your ROI within this program. The other thing that happens is on every application that we put in, almost without fail, there's an information request that comes down the pike that we need to answer within a 2-week time period. And so many of these requests can be answered by information on customer service records in your portals. And if we had access to those portals, we can just go get the information, answer those requests, and move on down the road, versus having to bother you, get you to pull those or get the information from your vendor. So again, giving us read-only access to your portals, we believe is just going to make life easier for you. So when we ask you for that, we're not trying to be nosy. We're not going to change anything. We just want to make it easier for you and information we need when we need it. We always mention plan ahead. If you haven't participated in the program yet with regards to infrastructure, network management, planning ahead is key. You're going to need to change the way you do things a little bit to get full funding out of the program. Tracy mentioned it. So many people have purchased hardware in the past based on when it breaks. Some people plan ahead and based on service life and end of service life based replacements, and that's a really good way to do that. And we can plan for that. So planning ahead is key, but also every application, especially for hardware, has to be tied to a vendor. And sometimes hardware vendors are not already in the program, like most all circuit vendors are. And so making sure that your vendors are set up in the program, that they've got their proper certifications, and that they're done on time, so that the applications can be done by the deadlines. So again, that's something else that needs to be just planned for, coordinated. And we do a lot of vendor coordination, helping vendors get their certifications, because that's just part of getting the hospitals their money. So that's just part of what we do is coordinating with vendors as well. All right, down to next steps. If you're a new member, haven't joined the consortium yet, but maybe you want to think about it, just reach out to schedule a potential meeting, or ask for paperwork, or however you want to proceed. We can do a quick analysis and tell you how we think there might be some potential or not. We'll tell you that too. But we would need to execute some membership documents, because it's a government program, and they've got paperwork that's involved. And then we'd need to do that first, and then we would want to schedule some onboarding, which looks a lot like what our annual checkups look like, which we do some deep dive into those eligibility categories and look at your planning, keep you guys educated on, keep your IT staff educated, your IT planning staff educated on the program and all those eligible categories, so that you can start building that into your planning, so that, year in, year out, you can start gathering those dollars. Because we look at it as a long-term process. What are you getting out of the program long term? There might be a spike one here, or a miss there on a technicality on a given year, but what are you getting in long term out of the program? And keeping your IT group educated and building it into your planning, that's where you're going to get the most out of the program long term. All right, so if you're some of you existing folks out there, and we see you on the line, thanks for joining today. If you haven't been contacted already, you will be contacted for the annual checkup, and please respond to those. It's only once a year that we have to do that, and we'll get into those and let you know the documents that we need to get the applications underway for the next year. But watch for those. You'll also see at this time of year emails coming in for the awards from the previous year. So just kind of watch for the email to differentiate between when we're asking you for the annual checkup, and we're going to want to set you up for the 2025 applications. So other than that, you guys know Mike and John. You can contact either one of those to get started. There's Tracy and I's contact information. You can get a hold of either one of us. And at this point, we can open it up for questions. I don't know if any were chatted in during the time period.
There was one, and Tracy was quick to respond. There was a request if we could share these slides with the registrants and attendees for today.
Yep, we certainly will.
Other questions for the NHA Connectivity Consortium? Again, as I shared to start this webinar, at the NHA, we understand our hospitals are hurting. On a recent pulse survey, it was indicated to us that nearly 50% of member hospitals across the state of Nebraska are either experiencing or will be experiencing a negative operating margin. And so we want to identify as many solutions as possible to help with that effort. So. And I think Randy said it best. If this is something of interest, it's a federal program. We'd be happy to spend 10, 15 minutes with you or your organization. Take a quick look, see what you're filing for, and ensure that your facility is maximizing this subsidy. It's well worth, in my opinion, it's well worth the 10 to 15 minutes. the best news we can give you is peace of mind and say, yes, you are. So.
Yep, and I mentioned the earlier you reach out, the better. If you wait until February, we're going to say it's going to be too late for this year. We'll talk to you next year. But this right now is a great time. This summer, this fall, a great time to reach out, and we'll be well poised to look at your situation, look at your vendors, look at your history, and let you know if there's opportunities for you for 2025. So we'd love to work with all of you and the existing members. We look forward to getting the annual reviews taken care of this year and all the applications in place for 2025. And thanks for being members. We love working with all of you.
Randy, let's give it just 30 seconds here. I don't want to, just in case someone's typing, please feel free to unmute too. And if you're not comfortable asking a question, please send a private message to me. I'm happy to ask it on your behalf. Nothing like embracing silence, right? I don't think we have any additional or questions from the audience. So as highlighted at the end of the slide, please reach out to myself or John or anyone here at the NHA to learn more about the Connectivity Consortium. I know Randy and Tracy are always eager to help and answer questions as well. So please feel comfortable. I encourage you to reach out to them. But if you have questions, let us know. We are here to help. With that, Randy, Tracy, thank you. This is always very informative. And let's go ahead and conclude today's webinar.
Thank you, Mike. Appreciate the time.
Thank you, everyone. Thanks for joining.
Thank you.